In this third and last video on the history of American health, disease, and medicine, we're going to focus on the 20th century. Without a doubt, the progressive era in the early 20th century witnessed a boom in American medicine, given that optimism and faith and expertise in government regulation sort of characterized the period. As the U.S. Public Health Service began and grew, an American Army doctor working in the Caribbean, Walter Reed, discovered that mosquitoes spread the feared and deadly yellow fever that had ravaged temperate climates. This contributed to the rise of the new fields of epidemiology and biomedicine. You can see Walter Reed on the left here. Of course, the Army Hospital is famously named for him, Walter Reed Military Hospital. It was during the Progressive era that the American Medical Association was formed, sort of formalizing the medical schools and the practice of medicine. With medical science growing, you really see a change in the way people addressed mental health care. In the earlier in American history, if somebody were mentally ill, they might be described as being insane, and they were sent off to lunatic asylums. Or if they were a threat to themselves, they might be put in a straitjacket or a padded cell. But the assumption was that if you were mentally ill, you had no abilities and you could not be helped at all. Now that's going to change with the expertise of the progressive age. With the progressive age, the new type of treating mental illness is, of course, psychology and psychiatry. The American Psychological Association was founded right about the time of the progressive age, and you begin to get the idea of therapy. And in time with psychiatry, you begin to get testing on the pharmacology of mind on drugs that affected the perception in mind. As the progressive era learned that people with mental illness maybe could be helped, that there was a better way of doing things, you also see the women's rights movement growing. And as part of that movement, you have Margaret Sanger, who believed that the fact that female birth control, things like the diaphragm, which had become available in Germany, were illegal in the United States, was a women's rights issue. Women should have control of their own body and should have control over reproduction. And so she founded a journal called Birth Control Review and first birth control clinic in America, and that was considered quite controversial. Today, of course, the Margaret Sanger's organization has become Planned Parenthood. Just as World War I ended, an outbreak of the H1N1 virus spread across the globe, becoming infamously known as the Spanish flu because it was reported early, but incorrectly, that Spain had been hit particularly hard. The Spanish flu consisted of 4 successive waves that took place between 1918 and 1920. Estimates are that the virus reached a third of the world's population, killing somewhere globally between 17 and 50 million people. In the United States, public health measures, including the use of masks, helped, but still approximately 650,000 Americans died. The Spanish flu was, of course, one of the world's worst modern epidemics. In 1922, a major advance in medicine was the discovery of using insulin to treat diabetes. And insulin, the first insulin was used, I believe, from pigs, and later on they were able to create a man-made insulin that was more widely available. But when you had type 1 diabetes, as we call it today, if you didn't get insulin, you died. And so insulin was literally a lifesaver. Racism remained a problem in public health, just as in every facet of American life. Beginning in 1932, the U.S. Public Health Service conducted Tuskegee syphilis experiments, which sought to learn the natural history of syphilis. The study observed 600 poor African American sharecroppers, promising them free medical care, 2/3 of which had the disease, and the rest was considered a control group. The study deliberately kept the men's diagnosis a secret and denied them care if the doctors knew that they had syphilis. Amazingly, the study lasted until 1972. Just as World War II is breaking out, an African-American doctor, Charles Drew, developed a way to separate plasma in the blood and thus create blood banks. This allowed a readily available supply of blood and saved thousands of lives during World War II. World War II led to tremendous improvements in surgical techniques, as you might expect. Penicillin had been discovered in 1928 in Scotland, but in 1942 it was first used to combat infections. Its use in World War II led after the war to a tremendous growth in antibiotics, which dramatically impacted health care and mortality. Another lasting and important ramification of World War II was the spread of employer-based health insurance, a product of government regulations during the war. To fight inflation, the government limited salaries. With few people unemployed given the massive war effort, businesses struggled to attract top talent. They soon learned, however, that they could negotiate with private health insurance companies and strike a deal. They would get a lower group rate in exchange for assuring the company a large number of customers. The employer would then offer the potential workers a benefit whereby the employer would pay most or all of the workers' company premium. This employer-based health insurance grew in the post-World War II years, and it became the norm for most Americans. Advances continued after the war. For example, after the war, scientists employed the first steroids. Here, scientists are displaying a model of the molecular structure of cortisone, which was developed in 1946. In 1950, you begin to see the first antihistamines. About that same time, in 1952, you get the first heart pacemaker. Again, in the post-war years, 1953, Watson and Crick discovered the structure of DNA, which is going to be dramatically impact genetic research going forward, as we'll talk about here in a second. Perhaps one of the most profound of the post-war treatments that was begun was a cure for the feared disease polio. Jonas Salk, shown here, was the one that invented it. And, but polio, you could catch it and it could paralyze you. Some people, we often catch it, young kids would be paralyzed, they'd be paraplegics, but others would be quadriplegic and have to spend their whole lives, or as long as they lasted, in an iron lung, which used pressure to compress and make you breathe. Your head kind of stuck out of the end. You can see some of these iron lungs in the picture on the top right. It'd be horrible, that is. So Jonas Salk's cure for polio was considered a huge thing in the 1950s. During the Korean War of the early 1950s, you see the system of triage that Letterman had first created in the Civil War really improved, and it's improved in large part by the use of helicopters. In the war, they had mobile army surgical hospitals, and rather than have these wagons like in the Civil War, they'd use helicopters, which could fly in very quickly and take someone just as quickly back into these tent doctors who would do triage. If you're familiar with the 1970s, 1980s TV show MASH, it's based on one of these triage units. To oversee all the federal health functions, Congress created a new cabinet-level department in the 1950s, the Department of Health, Education, and Welfare, or HEW. When education decades later was spun off into its own separate department, the Department of Education, HEW became known as the Department of Health and Human Services, or HHS. This department still exists today. So on the left here, you can see the symbol for HEW, and on the right for HHS. A big advancement in health was in 1964 when the Surgeon General issued a report that cigarettes smoking was hazardous to your health. It sounds silly now, but everybody smoked before then, and so it really cut down on number of people smoking, and undoubtedly cut down on cancer in later years. When the Surgeon General came out with his reports, the government passes legislation, the Federal Cigarette Labeling and Advertising Act, that strictly regulated how you could advertise cigarettes and smoking. You couldn't send it to kids and so forth. Of course, when you get to the 1960s, one of the most significant health legislation ever was signed by Lyndon Baines Johnson, LBJ, during his Great Society. And it provided for a system of national health insurance. It was called the Medical Care Act of 1965. Now, a system of national health insurance had been proposed by every Democrat since Harry Truman right after World War II. And so when Lyndon Johnson signed the Medical Care Act of 1965, he invited the elderly Harry Truman to witness. And so here you see LBJ signing it and the old Harry Truman looking on. The Medical Care Act created a federally funded program of hospital and medical insurance for the elderly, known as Medicare. Now, it covered most people 65 and older, included a basic health plan that provided up to 90 days of hospital care, 100 days of nursing home care, and 100 home health care visits. A supplementary plan, available to those who paid $3 a monthly premium, covered 80% of the cost of a variety of health services, after a deduction of $50. The money for this came from general revenues and an increased Social Security tax to pay for it. Of course, this is building on the private health insurance through your employer that had grown from World War II. The Medical Care Act also authorized federal funds to the states to provide free health care for the poor and indigent. This was known as Medicaid. Of course, during the 1960s and the Great Society, medical technology, medical knowledge continued to advance. And there are many things I could say here, but one of the important ones was in 1967 when you had the first heart transplant. But of course, there are new problems as well as new inventions. With the growth of the sexual revolution in the 1960s and 1970s, obviously new problems emerged. Herpes infections became common in the 1980s, and you can see a graph of genital herpes here in the middle. Much worse in the 1980s was the spread of a new epidemic, the acquired immune deficiency syndrome, or AIDS, which came from the HIV virus, and it was deadly. First depicted among the gay community, it was largely ignored by the government and much of the public, who saw it as God's wrath for a homosexual lifestyle. Soon, however, by the end of the 1980s, it was becoming obvious that it would spread to anyone through bodily fluids, including unprotected heterosexual sex and blood transfusions. The case of a young boy named Ryan White, who got the virus through a blood transfusion, brought much needed attention to the epidemic. And you can see a picture of Ryan White here on the left. By the 1990s, it was apparent that healthcare faced a crisis. Ever since World War II, as we said, most Americans had gotten health insurance through group plans private companies negotiated with insurance companies. In these plans, the employer and the employee paid part of the cost. With the growth of medical technology and science, however, medicine could do more, but the cost rose as well. Insurance companies, having to cover more, raised rates, and in time, facing these higher rates, some companies decided to drop health insurance coverage for their employees. These now uninsured employees could not afford insurance on their own and often avoided medical care, only showing up in the emergency room in bad shape, where the hospitals were required by law to treat them. The hospitals would, in turn, pass the cost of treating these uninsured people on by raising the rates they charge for their insured patients. This, of course, caused additional costs to the insurance companies, who then raised their rates for the employers and employees. More companies would then drop their insurance coverage, creating a vicious cycle that kept getting worse. Healthcare costs grew tremendously during the presidencies of Ronald Reagan and George Bush in the 1980s and the presidency of Bill Clinton in the 1990s. And you can see that that's where this graph really takes off, is in the 80s and 90s. By the time Clinton was elected, 20% of the American population lacked insurance. And so what he did was he appointed a task force led by First Lady Hillary Clinton to sort of propose a solution, find some way to see if they can get to universal health care insurance. Now, he got a lot of criticism, nepotism, and appointing a first lady, but keep in mind that Hillary Clinton was an accomplished lawyer. And the Clintons' task force met in secret, which also engendered a lot of criticism. When they issued its report, the task force rejected a single-payer system, which many liberals wanted, but rather proposed a health care plan based upon the extension of employer-based health insurance. Individuals not insured by employers would be insured by the government. The plan would also expand the government's regulatory role in a concept known as managed competition, with the government setting a minimum level of health benefits that each plan would have to provide. It also prohibited insurers from charging different rates for customers based upon age and pre-existing conditions. Of course, some of these requirements were later incorporated into Obamacare. Clinton made health insurance his major domestic initiative, but the insurance companies figured that they would have to face higher costs, and so they fought back, really flooding the airwaves with advertisements. And the most famous one was one entitled Harry and Louise, which showed a couple saying that the government bureaucrats would be controlling their health care and costs would be going up. Meanwhile, the GOP, under an upstart arch-conservative congressman from Georgia, Newt Gingrich, helped unite the party in agreeing not to compromise at all. Presented as a socialized medicine and defeat it. In the end, Gingrich's plan and the insurance advertisements, they worked. Clinton's plan was defeated. Of course, medical advances continued as politics impacted healthcare. By the 1990s, the medical community was widely using the antiviral drug AZT to prevent the spread of HIV. It helped make AIDS something less than a death sentence. In 1996, scientists in Britain cloned the first mammal, Dolly the sheep. In the years since, scientists have cloned several other large mammals. Perhaps one of the most amazing advances in medicine was the completion of the Human Genome Project, first begun in the 1990s. It was an international research project with the goal of determining the base pairs that make up human DNA, thereby building upon what Watson and Crick had discovered earlier. Anyway, they were going to identify and map all the genes of the human genome from both a physical and functional standard. And in 2003, it was declared complete. Under President Bill Clinton, the United States decided that the human genome sequence could not be patented and thus would be available to all researchers. And this helped lay the foundation for continued advances in understanding human diseases and perfecting new technologies such as gene therapy. Today, biomedicine and the science of genes promises even greater medical advances in the future. During the early 2000s, President George W. Bush supported budget increases for science, but stringently opposed abortion and even prohibited federally funded research on embryonic stem cells. Social conservatives believed that embryonic stem cell research was immoral, while Democrats noted that embryonic stem cells could grow into any type of adult cells, and thus medical advances would follow if we could do research on them. Stem cell research promises important advances in the field of regenerative medicine, which focuses on replacing, engineering, or regenerating cells, tissues, and organs in order to achieve normal function. While Bush's ban slowed research, in recent years scientists and researchers have made another breakthrough by identifying conditions that would allow some specialized adult cells to be reprogrammed genetically to assume a stem cell-like state. This new type of stem cell is now known as induced pluripotent stem cells, iPSCs. Certainly during the first decade of the 2000s, corrective eye surgery became more popular as lasers improved. Laser technology has been used in a number of medical innovations. During the presidency of Barack Obama, Democrats in Congress passed the Affordable Care Act, which again sought to address the problems of declining health insurance and rising health care costs. The plan sought to increase health insurance coverage by building an exchange or market where citizens no longer covered by employer-based health insurance could buy private insurance. Competition between the companies in the market would keep prices down. People who still had employer-based plans weren't affected, and they could keep their existing insurance. The legislation mandated that people have insurance or pay a penalty. This assured the private health insurance companies a vast pool of customers, so the private insurance companies signed on to the legislation. The private companies would be required to offer plans that allowed children to stay on their parents' plans until they reached the age of 26. They also had to cover people with pre-existing conditions, among other required benefits. People could choose plans with varying costs and benefits, but would pay for the plans themselves. Those with limited means would receive subsidies to help cover the cost, while an expansion of Medicaid would ensure that even the poorest and unemployed had coverage. With, in the end, more universal coverage, hospitals would not be left with the additional expense of paying for uninsured patients in their emergency rooms, which would also help keep costs down. As they had earlier protested against the Clinton administration's proposed health reforms, Republicans decried the Affordable Care Act as, quote, socialized medicine, and not one Republican voted for the legislation, which they derisively termed Obamacare. In time, they sued, arguing that the penalty for not having insurance was unconstitutional. With new conservative justices, the Supreme Court agreed and struck down the penalty. The private markets and regulations, subsidies, and Medicaid expansion remained. Even after the penalty, however, the markets remained profitable and successful. Healthcare costs continue to rise, but the rate of the increase has slowed. Today, millions have health insurance through the Affordable Care Act's marketplace. Republicans continue their efforts to overturn the legislation and have promised their own health insurance plan to replace it. Today, the promise of continued advances in healthcare is encouraging, even of course as problems remain. The obesity epidemic today has led to a dramatic increase in heart disease and diabetes is only one example. You can see that in the United States, those numbers of people that are either overweight or obese is greater both for adults and children than elsewhere in the world. The threat of pandemics, just like the Spanish flu in 1918, remained, of course, and we know this because of the spread of the coronavirus or COVID-19, named for the year it began. And as this video is being made, we have already 320,000 dead, and undoubtedly that number will be rising. Medical science, of course, rose to the occasion, and in an amazing development, developed a vaccine, a new mRNA technology that blocked the protein that the COVID virus uses to lock onto cells. And it's amazing that they did this in record time, and it promises an end to the COVID epidemic, another century-long, once-in-a-century type of outbreak. In any event, this concludes the third and last video on the history of American healthcare, disease, and medicine.